When you think about the biggest ethical problems in healthcare, what pops into your head? It's a huge question, right? And usually the answers are pretty high stakes, pretty emotional. But what if I told you the single biggest challenge is one that almost never makes the news? Okay, let's get into it.
No, really, just for a second, think about it. What would your answer be? Is it about who gets a life-saving transplant? The insane cost of drugs? Maybe it's just about being able to see a doctor in the first place. There are so many things it could be.
Yeah, for most of us, our answers probably look something like this. We're worried about waiting lists, which can feel endless, the terrifying thought of a medical mistake, the constant drumbeat about not having enough doctors, or making sure our older family members get the care they deserve. These are all massive, totally valid concerns. But to get a different take, we're going to look at this really fascinating study from the University of Toronto's Joint Centre for Bioethics. Back in 2005, they got a panel of 12 clinical bioethicists together. These are the folks whose entire job is to deal with the thorniest ethical problems inside hospitals, day in and day out. And they asked them one simple question. From your perspective, on the front lines, what are the top 10 biggest challenges? And this is the list they came up with. Now you'll see a lot of the things we just talked about are on here. Waiting lists, that's number 2. Medical errors made the list at number 5. A shortage of family doctors, number 4. And you've also got these really complex issues like withdrawing life support and making sure patients are truly giving informed consent. But what about that number 1 spot? So here's where it gets really interesting. Things like waiting lists get a ton of media coverage and government attention, as they should. But the experts, the people who are in the trenches dealing with this stuff every day, they said the single biggest challenge was something else entirely, something most of us have probably never even thought of as an ethical problem.
So what is it? I mean, what did these 12 experts who handle over 1,200 ethics consultations a year between them, what did they identify as the absolute number 1 ethical problem they face?
This, right here. The number 1 challenge is the conflict that erupts when patients and their families disagree with doctors and nurses about what to do next. It's not some big policy debate or a funding crisis. It is a deeply human, deeply personal, and incredibly common conflict. And this quote from the study's authors just says it all. They're basically saying, isn't it weird that the thing we deal with the most, the thing that causes the most distress, is almost completely invisible to the public and to policymakers? And we're not talking about a rare thing. The study points out that this is the single most common reason they get called in for an ethics consult. And these conflicts, they get the most intense, the most emotional, and the most difficult in the ICU, when the decisions being made are literally about life and death. So to really get why this happens, you have to see that it's 2 completely different worlds colliding. You've got the medical team. They're living in a world of data, statistics, and prognosis. They see an aggressive treatment and might think of it as just causing harm, as being futile. But when they tell a family there's a 90% chance of mortality, you know what the family hears? They hear there's a 10% chance of survival. They are guided by love, by hope, by faith. And that's how you get this total breakdown, where the team starts thinking the family is irrational, and the family starts seeing the team as cold or disrespectful. So what this really boils down to, the thing that's so crucial to understand, is that this isn't just a simple disagreement over the facts. The study calls it a fundamental clash of value systems. You have the professional, clinical values of the medical staff crashing right into the deeply personal, cultural, and spiritual values of a patient and their family. And that's really the heart of it. This isn't about figuring out who's right and who's wrong. There's no easy answer here. It's not about winning an argument. It's about 2 groups of people both trying to do the right thing, but operating from completely different playbooks. Okay, so if this is such a huge and fundamental problem, what do we do about it? Well, the great thing is, the researchers didn't just point out the problem. They actually laid out a roadmap with 4 really concrete ideas. First up, better education. We need to train our doctors and nurses not just to communicate, but in actual negotiation and mediation. Real skills for these tough talks. Second, hospitals need clear, consistent policies so there's a fair process for working through these disagreements. Third, we need to do more research from the patient's side of the bed to really understand what they and their families are going through. And finally, let's drag this issue out into the light. Report on it, talk about it, and get the public involved in finding solutions. This quote from the paper it really nails it. It's such a powerful reminder that for a family in this situation, this isn't some kind of abstract problem. It is driven by the most powerful human emotions there are: devotion, duty, and most of all, hope. So you see, when you strip it all away, the number one ethical challenge in healthcare isn't really about fancy technology or not enough money. It's about us. It's about people. It's about the difficult, messy, but absolutely critical work of communication, empathy, and finding a way to bridge the gap between our different values. Which I think leaves all of us with a really important question to think about. In those hardest moments, when everything is on the line, how do we build a system that doesn't just treat an illness, but that truly, genuinely hears and respects the values of every single person involved?